Bismillah ar-Rahman ar-Rahim. This was a 6-month child. He had repeated attacks of hematemesis and melena. Portal vein duplex was asked for, and we did the exam. We found that we have here the liver. This view is right anterior to mid-axillary line view, oblique, slightly oblique posteriorly, with the probe put upon the intercostal spaces at the right hypochondral region. We found that at the site of the portal vein here, we don't see the portal vein, but we see as narrow, thin channels, serpiginous channels that are replacing the course of the portal vein, like this. Here we have multiple channels that are replacing the course of the portal vein. On color study, we see that these channels take color flow, that is, makes it towards and away from the probe in its direction. We see channels taking red colors, other channels taking blue color. What was this? This was portal vein cavernomatous transformation, or cavernous transformation, or as well known to be portal vein cavernoma. What is a portal vein cavernoma? Portal vein cavernoma is a process that happens because of chronic portal vein thrombosis. Then we have a thin, very cord-like portal vein, echogenic cord-like portal vein that is not functioning, so it's replaced by multiple collaterals that take the course of the portal vein, trying to supply the portal vein, supply the liver. So what happened in this case? This was a 6-month-old baby. So what we had actually, despite of having no definite history from the parents, but we had the history that the patient was admitted to NICU just after birth. We don't have straight or clear history of insertion of umbilical cath, but this is the possible scenario that the neonate at the NICU had umbilical cath insertion, and this is a well-known complication of umbilical catheterization in neonates. Even if after removal of the catheter the patient didn't have symptoms directly, but maybe he had a portal vein thrombus that was acute, then developed to be subacute, then to be chronic, and then cavernous transformation that usually occurs after about 6 months of the initial thrombosis of the portal vein. And this is a possible scenario, clinical scenario, that had happened to the patient. We have definitely here by ultrasound and Doppler, we have portal vein cavernoma. We also had few serpiginous channels that are at the porta hepatis that can represent the presence of portosystemic collaterals, with the history of the patient to have repeated hematemesis and attacks of melena. This can be considered or can be diagnosed to that the patient had portal hypertension because of the chronic portal vein thrombosis and cavernous transformation. In this case also we had gallbladder mud, we had dilated splenic vein. Here this splenic vein, it was patent, but it is dilated, measuring about 7 millimeters. The spleen was enlarged. Also we had congestion in all gut segments, the small bowel, the large bowel. Here we have the transverse colon, we have edematous thickened walls of the sigmoid colon. This can be explained by the portal hypertension. Also the patient had ascites, and also he had another finding that's not related to the main problem of the portal vein. He had as an inflammatory collection, as we see here, at the costochondral junction of the right 8th rib. Inflammatory collection, chronic, it's more or less heterogeneous, with air foci inside and with irregularity of the surface of the cartilage of the rib, and also of the cortex of the rib. So it was intimately also related to the pleura here, as we see. So it was some sort of inflammatory collection, likely secondary to chondritis or osteomyelitis of the eighth rib. Thank you.